How do you set smart behavioral goals? Imagine trying to hit a target in the dark. Without a clear plan, it's hard to know if you're making progress or even aiming in the right direction. That's where SMART goals come in. They help turn vague ideas into clear, actionable steps. When working on changing behaviors through cognitive therapy, setting these kinds of goals makes a big difference. First, you want your goal to be specific. Instead of saying, "I want to feel less anxious," say, "When I feel anxious at work, I will take 5 deep breaths and then write down my worries." This way, you know exactly what behavior you want to change. Clarity helps focus your attention on what really matters. Next, make your goal measurable. You need a way to track your progress. For example, you might decide to practice your coping strategy 3 times a day or aim to reduce negative thoughts by half over for weeks. Having numbers or clear criteria makes it easier to see if you're moving forward. Then, your goal should be achievable or action-oriented. It needs to be realistic given your current resources and situation. If you're new to relaxation techniques, starting with 5 minutes of deep breathing is better than trying to meditate for an hour. Small, manageable steps keep you motivated and prevent frustration. Your goal also needs to be relevant or meaningful. It should connect to your personal values or what you really want to improve. If reducing anxiety helps you enjoy your daily activities more, that makes the goal worth working toward. When goals matter to you, it's easier to stay committed. Finally, set a time-bound deadline. Decide on a clear time frame, like, "I will practice my coping strategy every day for the next 4 weeks." Having a deadline creates a sense of urgency and helps you stay accountable. In cognitive therapy, goals are often framed as start actions, things you will do rather than things you will stop. For example, instead of "stop worrying," you might set a goal to write down worries and challenge negative thoughts when they happen. Breaking big problems into smaller, SMART goals makes change more manageable. For example, a client might aim to record negative thoughts daily and try to cut them in half within a month. This goal is specific, measurable, realistic, relevant, and has a clear deadline. Using SMART goals helps you see progress, stay motivated, and adjust your strategies if needed. Overall, setting these kinds of goals gives you a clear plan to follow. It makes your efforts more focused and helps you notice improvements along the way. When you link your goals to what truly matters to you and set realistic timeframes, change becomes much more achievable.